Well, let's see. Can you hear me? Yes. Oh, good. It actually works. I go back 44 years with Dr. Torrance when he first started here in 1972. And for all those years, he has been a professor, a mentor, a counselor, and quite frankly, since I'm now a lecturer here at the school and I've been teaching for 5 years in the extension health certificate, I try to model my teaching after him and my approach to students that, as he said, you change lives, and it just all comes back. It is both ways. First of all, you also should know that this is live streaming and it is being videoed for future access through a link so that you can revisit this if you wish, and hopefully those who couldn't attend can see it. I want to thank you, the audience, for being here. This is near a record attendance, I'm told, and I really greatly appreciate your time here. I want to thank the panelists who I will be introducing. I think we put together a very pertinent topic, a forum, and we entitled it Volume to Value, a Transformation of Medical Practice. I think the Medicare Access and CHIP Reauthorization Act, called MACRA, to make it easy, is going to transform medical care. It's simple as that. To me, it looks like it's going to be the biggest thing since Medicare started, because it's going to move us from the fee-for-service mentality of volume to more of a quality proposition and reward or penalize based on outcomes and not just for doing something. I want to thank Esther. Where's Esther? Esther Sook, back here. She was the person who was the coordinator, the logistic person. She put things together to make this happen. And a pleasure to work with, and I'm very pleased to do that. And finally, before I go to the introductions, I want to have a shout out to all my current and former students that are here. And I appreciate you coming, and we continue to do mentor with you, so I appreciate that very much. So when Paul and I talked about creating this forum for tonight, I'm on the advisory committee for the health forum. This is my third one actually put together, but you know, I couldn't think of a better topic. I said, Paul, we got to get this out here. We got to get it known. And so I had the good fortune of working with 3 excellent panelists who I thought would be very appropriate. The first one that I had talked to about this was Dr. Ashby Wolf. She's currently a board-certified family physician and still practices, but she's the Chief Medical Officer for Region 9 of CMS. It's a large region, and her expertise is how do you put something like this into play? How do you get feedback, regulations, and make this happen? And she's one of the most approachable CMOs I know. And she's just excellent to work with, and would hope to have her here even in the future. The second panelist is Scott Weingarten. Dr. Weingarten is extremely well respected as the Senior Vice President and Chief Clinical Transformation Officer at Cedars. And so when I thought about the program, I thought, yeah, we can have the regulations and the law, but we also need to hear from a physician about the transformation of medical care under this, going towards population health and integrated health services. And he's an outstanding speaker on that, and I'm really pleased to have him. He is actually also going to guest lecture for my class in integrated health systems this Friday evening. And I appreciate him taking that time. Bill Barcelona is the Senior Vice President for Government Affairs for CAPG. Do you know what CAPG is? Let me tell you what it is. Please look it up. It's a very important, I think, organization in the movement towards population health. California Association of Physician Groups. Don Crane's the president, and Bill's in the realm of the government and legislative and regulatory. So when we had the progress from Dr. Wolf to Dr. Weingarten, and then Bill can talk a lot about how you put this into play. And our California Association of Physician Groups, how many are there now, El? Do you know what the...
180 in California,
yeah.
210 national.
Yeah. So it's all of the medical groups that you have heard about that are taking the risk of capitation and moving this to value. And so I do recommend looking up California Association of Physician Groups. They also put on one of the best annual meetings I attend. This will be my 30th. I'm attending, Bill. So, okay, with that, I'd like to then ask you to hold questions till the end. After each make a presentation, they're going to sit up there as panelists, and we can take questions. There should be roving microphones. What I would do is repeat your question so they could hear on the live streaming. So, Dr. Ashby, please come up. Thank you. Thank you.